have probably heard of BRCA genes, but did you know that there are pills that can be used to treat patients who have mutations in their BRCA gene? My name's Cheyenne Hardy. I'm a PA working as a provider in the cancer field, and I am passionate about empowering you to understand and take more control of your health journey. The BRCA genes, there are two of them, stand for the BR in breast and the CA in cancer. But actually, if there's a mutation in these genes, it doesn't just increase the risk for breast cancer, both in males and females. It also can increase the risk for prostate cancer or ovarian cancer or other types of cancers. BRCA genes encode proteins that help to repair the damage in our normal healthy cells. When the BRCA gene is mutated, that means that there's damage that builds up in our cells. This can lead to the development of cancer cells that grow and grow and grow and are not killed off, or it can just lead to a buildup of damage and cell death early. Either way, our normal healthy cells want to repair the damage and then go about their lives, finish out their life cycle, and die a peaceful death. Cancer cells also want the same thing, even if that would be bad for our bodies for them to continue living. However, with cancer cells, they already have a problem with their cell cycle. They are just living and living and living an endless cycle, not dying off. That's why they grow in our bodies. That's why they crowd out healthy cells. And so we, of course, do not want these cancer cells in our bodies. But because the BRCA mutation is present, it is not killing off damage. And so the damage is building up. We're having more and more cancer cells in our body, and the cancer cells themselves have more and more damage to them. So what do they have as a backup mechanism to try and repair their own damage? PARP enzymes. PARP stands for ADP-ribose polymerase. Really, this is just a fancy way of saying enzymes that repair the damage in cells. In these cancer cells, this means that if you're repairing damage in them, they can continue to live and live and live forever. So what do we need to do? We need to kill off the PARP team. We need to inhibit the PARP team. Well, we have medications. We have pills now that are called PARP inhibitors. In breast cancer, we have 2 PARP inhibitors that are approved for certain patients, and we'll get into that. The first PARP inhibitor for breast cancer is olaparib or Lynparza, and the second is tolaparib or Talzenna. Now, PARP inhibitors in breast cancer are approved for certain patients, so there's some qualifications that you have to meet. First, you have to have the BRCA1 or 2 mutation. Second, and we'll dive more into these terms in other videos, but you have to be HER2 negative. This means that you could be triple negative, you could be negative for the HER2, and you could be negative for the estrogen progesterone receptors, the hormone receptors, or you could just have a positive estrogen receptor but still have a negative HER2. The main thing is BRCA mutation and negative for HER2. So once you've met these 2 qualifications, then we look at stage. PARP inhibitors are indicated for some patients who have early stage but high risk disease. This risk is based on the size of your tumor, the grade of your tumor cells, and some other factors. Or if you have metastatic disease, meaning it is spread out of the breast, out of the lymph nodes, into other parts of your body. Usually, if treatment is given in early stage, it's for about a year. And if it's given in the metastatic setting, it is until you can't tolerate it anymore or until something else changes in your breast cancer diagnosis. PARP inhibitors are fairly well tolerated in terms of side effects. But what are some things that we see more often? Well, mild to moderate fatigue is a main side effect of the PARP inhibitors. We can also see anemia or low hemoglobin. This can lead to feeling tired, short of breath, just lethargic, and this one can be more severe, so we want to keep a close eye on your labs. You could also have increased risk for infection or increased risk for lung inflammation or pneumonitis. So really watching for a new cough, feeling more short of breath, fevers, and letting your doctor know if you experience those symptoms. There's also a small risk for secondary malignancies or developing a blood cancer years down the road. Now that you feel more informed about the BRCA mutation and PARP inhibitors, what does this mean for you? Well, maybe you know you have the BRCA mutation already, but maybe you don't. It's important to ask your doctor, have I had genetic testing and do I have any mutations? If so, what are they? What do they mean for me? Always ask those follow-up questions. The second question to ask is, if I have the BRCA mutation, do I qualify for a PARP inhibitor? Why or why not? It's good to take some notes, write down, so that if your family asks you, well, why can't you be on a PARP inhibitor, then you know what to tell them. And our last question is, maybe you are on a PARP inhibitor already. What were my last labs? Do I have anemia? Are we worried about my blood counts? Is that why I'm feeling so tired? Or is the tired maybe coming more from the PARP inhibitor itself, less from anemia? Maybe I don't have any anemia. So good to just check in on all of those levels. We have a printout of these questions in the description box below. Feel free to print that out, take it to your doctor, write down some extra questions that you have so that in the office visit you remember and don't forget anything. Remember, you are the best advocate for your health. Thank you for joining me today to learn more about breast cancer, the BRCA mutations, PARP inhibitors. I look forward to seeing you back next week for more informative videos. Make sure to check out the description box below for additional resources to learn more about breast cancer, PARP inhibitors, and other parts of your treatment plan. I look forward to seeing you next week.